From the start, health officials here said this virus, this pandemic, was something no one could have imagined. There are testing systems and treatment plans we're using today that didn't exist a year ago. Tonight, doctors say we have to be prepared now for the next pandemic. Two healthcare professionals.
We don't want to see this again, and if it does come again, we want to handle it differently.
Battling on the COVID-19 front line since the very beginning.
Right now, we're facing a lot of nurses with fatigue. They tired. They need a break.
Lakesha Flynn is a nurse manager at Baptist Memorial Hospital. Her team cared for the very first COVID-19 patient in Shelby County.
Of course, all the fears came rushing in.
Her unit quickly transitioned into the hospital's COVID floor as active COVID cases jumped from a few dozen to about 90,000 right now in Shelby County.
They said 2020 was the year of the nurse, and it definitely was our year. We definitely learned a lot about how we are valued in the community, and we definitely appreciate it.
It's a value Flynn says wasn't always acknowledged before the pandemic. In fact, the community started 2020 with a nursing shortage. But Flynn says they learned how to meet the demand with nurses picking up extra shifts.
Our nurses have a soldier mentality, and we definitely know how to trial and make it through certain trials, and that's how we've done it. We just soldier together.
Yeah, and soldier through.
Soldier through.
But some of the lessons learned 1 year into this pandemic weren't medical. Flynn says they were personal.
I made sure that my team was educated on just staying safe. You got to stay safe for your patients. So you may have to miss that social gathering, that Christmas dinner with your family, just to prevent you taking yourself out of the equation to take care of patients.
While Flynn was behind the scenes, this doctor has become a familiar face during the pandemic.
As a community where we have high levels of community transmission of this virus.
Dr. John McCullers juggles several titles, but he's best known as a pediatrician-in-chief at Le Bonheur Children's Hospital, a member of the Joint COVID-19 Task Force, and as a pandemic expert.
Oh, I could write a book on stuff we could have done better. We did great, but there's a lot of stuff that, I think next time around maybe we'll do better.
McCullers says cooperation from all levels of government, area hospitals, and medical professionals was key to developing prevention strategies and guidelines. Knowing what you know now after a year of combating this coronavirus, what are you taking with you? What can we use now to be better prepared before the next pandemic?
Well, funding surveillance, that's one of the biggest things. Understanding where these viruses are when they come in. We had to invent the capacity to test for the virus at UT because nobody could test for it. So we need to have that in place before the next pandemic. We need to be watching these viruses as they come out of places like China and others, and we need to be ready for anything that comes out and have systems in place to be able to detect it and deal with it here.
Systems that are being challenged yet again as new variants mutate with unknown capabilities.
If they can reinfect people who have been infected or vaccinated, we're not back to square one, but we've taken several steps back. So we really have to continue to kind of get our case numbers down so that variant has less chance to spread, become dominant, to cause another surge.
Dr. McCullers says there has to be more funding for pandemics at the national level. Before COVID-19, he says there was a pandemic plan for influenza in the 2000s, but it hasn't really been a priority. Obviously, he's hopeful that will change after this global pandemic. In the studio, Kirsten Garris, Fox 13 Investigates.